Thanks, Steve, for the warm welcome. It's great to be here at the Nursing Times Workforce event again. So, as ever, the agenda is really packed, actually, with some really, I think, some exciting and really interesting talks that are going to talk about something I think that dominate conversations up and down the country. As Steve said, I'm National Director of Intensive Support, as well as also Deputy Chief Nursing Officer at NHS England. And we'll be supporting the long-term workforce plan, particularly looking at approaches we might be taking across nursing, midwifery and allied health professions in terms of the growth and opportunities that we will see. So today's kind of talk really is going to cover quite a bit of ground at some pace really, which is, as Steve rightly pointed out, a kind of real focus in on what do we understand about some of the kind of issues, challenges and barriers that exist in and around kind of the professional image of nursing. How does that relate to what is linked within the long-term workforce plan as an example? And we'll go through some of the kind of like trajectories and plan in terms of what this looks like, because essentially it's once in a generational opportunity to really right-size what we're doing in relation to the workforce across both the NHS, but there is an intrinsic issue here that, of course, the university sector, our IT colleges and also our organisations primarily trained across the health and care sector. Nursing is one of those professions that is linked across different parts of our health and care network. So there's kind of this important parallels, and I know Steve mentioned up front, particularly in relation to the workforce plan coming from social care, but we've always kind of approached some of our thinking in relation to what does the community look like, so what does education and training look like within localities across the system. But first of all, I think it's kind of really important to reflect on the journey that I think both the NHS and care sector has been on. I think colleagues may have been watching the COVID-19 inquiry today is Professor Chris Whitty's evidence session actually, and I think what is emerging from that is the kind of serious nature of the pandemic, but also in terms of some of the kind of decision making and the priorities. And I've always been very, very clear on every public stage I've been at that this country owes a debt of gratitude to our health and care staff up and down the country. The enormous efforts that went into preserving services as best as possible, delivering and supporting those communities, families and individual patients up and down the country, providing extraordinary efforts to be able to do that. But of course, one of the challenges that we face, of course, is the fact that we not only will we be judged in relation to things like a public inquiry on how we manage the pandemic, but importantly, I think I always reflect upon the fact that actually there is something for me about how do we rebuild back our health and care system, and also more widely, how do we rebuild back our society, recognising some of the huge challenges that created across the workforce. I was remembering the other day going through actually some of the information and timelines I had about my own COVID journey during this time, and recognising in the early stages some kind of recognition about events like this, both in terms of the physical detriments that these types of events cause on the workforce itself, but more importantly as well, the long-term challenges that you see across mental health. So I think there is a lot for us to really think about as a legacy of COVID-19, but on the other hand, I think there are enormous opportunities to start to rethink about what do we do as workforce, and this is very much the NHS and care sector is a people-based business. So, you know, nursing is such a strong component of that, but we're not an island, we work across teams. So there is something for me about really truly understanding about how we delivered services, also what we learned about that. So there are things that we would fundamentally want to carry forward in terms of opportunities to deliver better patient care and outcome. But on the other hand, there are things that we need to learn from in terms of aspects approach in relation to this. And that all of that has kind of fed into some of the work that we've been doing around the kind of long-term workforce plan. Now, of course, when we start to think about the process, if we are really fundamentally looking to reshape and redevelop and grow the NHS workforce over the next 10 or 15 years, I think we have to take a phenomenal step back and ask ourselves some really important questions, which is genuinely, what does health and social care look like in 2038 or 2040? I've seen enormous change in my career. There has been phenomenal pace of change. I was joking the other day with a colleague about the fact that I remember, you know, as an example, when, you know, pulse oximeters were first introduced into clinical practice, and I've worked with an anaesthetist who said, I'm not having that newfangled machine in my operating theatre, I've managed for 40 years without it. Finger on the pulse and eye on the patient is my mantra. So, you know, if I think about the pace of clinical change, just literally in the last 20 years or so, when we start to think about how that will accelerate, and also the demands placed upon us by our demographic changes, and also importantly, what we expect out of healthcare and what new and emerging challenges there will be, whether they're cancer, whether they're global climate change, whether there are many aspects of what we would do differently in relation to how we deliver health and social care services. So there is a really important question that not only people ask me, but I fundamentally think we need to ask the professions of nursing midwifery, is genuinely what does our profession look like? I was delighted to support and lead the work for the Chief Nursing Officer's strategy with Ruth May, our Chief Nursing Officer. And as part of that engagement process, workforce fundamentally comes back and centres in and around. So I think the conversations we've had across the country around workforce being such an intractable challenge for every people. So irrespective of whether you work in mental health, children's, adult, acute or community, everywhere we spoke to, there were challenges around workforce, not only in relation to the number of people available, but actually an important question about what do we mean by teams, what do we mean by skills and experience, how are we pushing the boundaries in terms of being able to deliver care differently as a result of really leveraging the experience of our nurses, as an example, or midwives. So there are some really important questions that led out of that strategy. And one of the main pillars is trying to recenter around a professional focus that looks at how do we bring this around our patients. So person-centeredness as an example. How do we build in models and develop a work that we need to do for people to understand, genuinely understand, about what it is that nursing or midwifery brings to patient care. And it's not just about the process of care, and I think this is really important. We need to be better at articulating what is the outcome. So what do we genuinely define as being the skills, the knowledge, the expertise that nurses and midwives bring to patient care? And it's not just about how do we transact that, what do we do, how do we go about it, how do we monitor the number of times we've done observations. It's actually about how do we identify whether we've actually solved a failed to rescue issue, how do we actually identify mortality, how do we actually look towards, as an example, a better outcome for those patients with mental health or those with learning disabilities. So there are really important questions, I think, that not only we have to solve from a policy level in terms of generating a different understanding across the community in relation to what nursing midwifery brings, but fundamentally that starts with, I think, a unique understanding within our profession. So part of the CNO strategy, building upon some of the workforce issues, actually broadens out a much larger set of questions and actions. So when the strategy is firmly launched, there will be a further opportunity around planning, development and delivery for really engaging lots of people across our professions to really start to identify how we can move forward with some of these really big questions that Steve posed, which is what is nursing? What is contemporary nursing? Because without us understanding that, it's therefore very difficult in some settings to go out to the public, importantly, but go out to future people to really start to think about, as an example, how do we recruit more people to come into our university programs or apprentice programs or others. So kind of my pitch today is for you to start thinking today about this as a question. And hopefully during the presentations that you might get, you actually prompts you to start thinking. So when we get to the engagement of the planning and delivery of the CNO strategy, you would have already started to formulate some of your questions and answers to some of these really important things I think that we need to do. Now, of course, I've been a nurse for many years now, and I'm very proud to be a nurse. And actually during the COVID-19 pandemic, we saw a phenomenal surge in interest. I remember speaking with the team who run the NHS Careers website, and they would send me charts and saying, you have no idea what level of traffic is going through the NHS Careers website. We've seen like a 210% increase in people looking for careers across healthcare, of which nursing was one of them, including things like paramedicine and others. So when we actually surveyed lots of people who had come into the programs during 2020 and 2021, when we spoke to the students themselves, the data was really powerful. So 9 out of 10 people who had come into the programs during 2021 had been inspired by how our nurses and midwives had worked across the NHS and care sector. As a direct result of that, it prompted them to move from being interested in a health-based career to actually applying to start. And whilst we saw quite a significant increase in nursing midwifery during this period, And I know there's always the data, and I do get slightly irritated by this, but we always kind of knew that there would be a COVID bounce of interest. And actually, whilst this year is slightly lower than last year, actually if you look at the long-term trend, actually the overall growth across nursing midwifery is up around about 5% from 2019. So we've capitalised on that really important aspect of COVID-19 and the interest in nursing midwifery. We've got ourselves back to a more normalised baseline in terms of growth. But there are two or three really important things that are going to be occurring. Firstly, we are at the early stages, the foothills of a demographic uptick in the number of 18-year-olds across our country, a substantial increase in those that will be coming through into our university sector, as an example. We also significantly have a long-term workforce plan, which I'll come on to in a moment to give you an overview of some of the issues that we will be facing, and also importantly what we're asking people to really help us with. And so these are really important kind of key levers, which is we've got lots of people out there who are looking for careers and opportunities. So we have to start now in terms of thinking about how do we engage schools, how do we engage colleges, how do we start to use that. But I know for a fact, because of COVID-19, there are large numbers of people who consider a career in nursing midwifery. Now, of course, without doubt, and I haven't got the clicker, so I can't move it on, sorry. So I pick that up. Just wave my hand.
It's on the lectern.
Oh, is it? Of course it is. Open your eyes, Mark. Excellent. So one of the things that we really need to kind of focus on is three main things, which is that without doubt, I don't think I've spoken to anybody, even across government in part of my role, that does not say that we absolutely fundamentally need to grow our workforce. You know, we need more people. And what those people do in practice, I think, is a really important question, which I'll come on to in a moment, because actually about inspiring people to have careers, I think is a really important question, which then leads me back to this really important point about what is modern contemporary nursing and how do we attract people into doing that. Now, what is also important is we need to retain staff. And I'll go into these in a little bit more detail. I've only got kind of 2 slides, but they kind of hopefully they'll be able to explain. But also reform, and I'll be honest, I kind of was at a summit very recently and somebody asked me to explain reform, and it's a really scary word because everybody kind of assumes that in some way it's some race to the bottom or we're trying to change things. Actually, one of the ways that I pose this is actually rather than reform, it's actually called reimagining. So it's actually started to think about, actually, if we want a modern contemporary nurse working in a completely different way, out in community settings, utilising advanced practice skills or enhanced practice skills, working with communities in a way that we want to get the best outcome for patients defined by what our inputs are. Actually, we need to work backwards from that. We need to reverse engineer how we would train and how we would develop, how would we support an individual to enable them to be able to deliver those sorts of capabilities within the type of healthcare. I think it's a really important issue, actually. So it's not reform for reform's sake. I'll come on to things like reform around training hours as an example, which I think is a really helpful discussion point. So there are things about how do we do things differently. And I think there are many people in the audience. I was familiar with people who used to talk about, as an example, when the house officer used to take down the dressings prior to the ward round. You know, and if I explained that to student nurses today, they would think this was from the 1820s, not from the 1990s. Or not being able to give first dose antibiotics because that's what the rules were for nurses not to be able to do that. So if I think back to how we have evolved practice, particularly in relation to advanced nursing practice, we've seen demonstrable shifts in terms of what people think about as a career and where the opportunities lie to do that. Now, of course, the long-term workforce plan is huge. And without doubt, it's one of the biggest resets that we will have in relation to the workforce. And it has come through a huge amount of in-depth assessment. Now, this is clearly based upon a lot of modelling assessments around the demand profiles, around demography, around the types of service provision, a real stretch in thinking about what the services look like in 10 or 15 years' time. Where do they work? I mean, I remember writing social policy essays as an undergraduate, talking about, as an example, the need to move more services to the community. And of course, here we are in 2023, and we still haven't done that. You know, so we have to be able to kind of guide and develop services that are going to be wrapped around families and communities in a way that makes sense to them and enable them to deliver better health outcomes, not just in relation to physical health, but mental health, but also about public health. is actually starting to think about the role and nature of all of our role in relation to public health and population health management. Now, of course, in taking into account all of this, there are a number of kind of questions that you pose around how does this, what does the model of care look like? And every time we came back to these sorts of assessments, we were identifying in relation to, well, we're going to need more doctors, we're going to need more nurses, more AHPs. And then the question is, how do teams get constructed? So what are those people going to be doing in practice? And I think that's an important professional question. So, now's the time to hand that from the big strategic policy assessment of what do we need, and the big question for you and the audience and our professionals is, how do we do that? How do we go about that with this type of investment that we have? So if I kind of think about some of the challenges, and I'll kind of do this slide because it'll probably be helpful to kind of illustrate some of the kind of key questions around this, which is, of course, we do need more people working in health and social care. Any type of assessment model that I've seen has identified without doubt that there is a fundamental need for things. But let's look at these numbers. We'll be moving the NHS workforce from currently about 1.4 million people in 2022-23, but to 2036 it will be somewhere about 2.2 million people. I'm not sure of the entire stat, so please don't quote me on this one. But that is kind of close to around about kind of 5 or 10% of the entire working population of this country will be involved in health, not health and care, because of course our social care colleagues will have equal numbers of people working in that. But of course we will need to substantially grow the number of nurses working in that service, and all of the estimates identify that will be in addition to what we currently have today, an additional 170 to 190,000 more registered nurses working in clinical practice. Now that will push us to probably just over the 500,000 mark across the NHS alone. That's actually as many nurses that currently reside on the English part of the register of the whole NMC across every single sector. So I'm just kind of like overlaying the point, the size and the scale of this. But of course, we're not an island. We work across, and as you can see from the slide, we've got allied health professions, and importantly, our support worker colleagues. One of the really important factors of this is, of course, we are not moving away at all from registrants delivering care. But importantly, we haven't got this right in the past, which is actually a lot of people who come into nursing often have care or health experience either as a support worker. I used to work in a nursing home as a 17-year-old. But actually, I was able to make kind of active choices about going to university to study nursing, whereas other colleagues don't have those life choices that I had or those life advantages. So there is something for me about two things, which is firstly, how do we build those long-term pipeline opportunities for people that mean that you can go from being a support worker to a registrant to a nurse consultant or even deputy chief nurse? But also importantly, and aligned to that, is that people should have opportunity each and every stage to do so in a way that makes sense to them. So either through apprentice routes or through university routes or through top-ups. So actually for me, it's about the breadth of opportunity that comes, because for many of you in this audience, you'll work in organisations that will fundamentally be the primary employer alongside local government. So we have a huge and enormous responsibility for social mobility, for widening access and participation, for dealing with the challenges associated with that, and particularly in isolated and rural communities where it's very difficult to recruit and retain. So, this can be a massive vehicle, a huge vehicle for change for an individual's life, but also importantly for a community as well. So without doubt, we have to grow. And I think this kind of says we've got £2.4 billion worth of government backing in relation to the training and education requirements of this, which will start to feed through. But of course, we can't train and grow unless we have a number of things in place, which is firstly, we're going to have places where these colleagues train. So placements are going to be mission critical. Now, I don't mean that that's just saturating hospitals with lots of student nurses, because actually that's not nursing. So we need to make sure we leverage all of our patient and placement opportunities across the whole life course, but also importantly across every sector. So, going to nursing homes, working in community settings, working with homeless and outreach services, adult nurses working in mental health nurses accessing placement experiences in physical health, and importantly in areas as well such as community, general practice, so where we need people to work in the next 10 or 15 years. We need to really expose our students to doing so. So I believe there is more than enough placement opportunity out there. The issue is how are we going to do that? Because actually high quality placements are going to be really critical, and each of us has a responsibility to train for the future. So there's placements. There is our university sector. So we have phenomenal universities, over 70 of them currently training nurses and midwives across this country. But actually one of the real challenges they have is a lack of people who want to go into training and education. So, the future senior lecturers who are going to train our future nurses, we all need to start thinking and working with our university sector to make that happen. And I know there's a lot of work going on in relation to how do we develop clinical educators, because this is going to be an important part of how do we grow in unison, both at placement level and at university level, to be able to do that. And of course, something that is really important to me, and I will emphasise this point, which is around widening access and participation. Because, like I say, whenever we have gone out for, as an example, apprentice into the registered nursing degree apprentice route, we have been inundated. The last time we did this, we had about 5,000 and 6,000 places. We probably had over 10,000 applicants to the process with the additional funding. So there is a lot of money attached within the 2.4 billion to support an expansion of apprentice models. Now, I know there's debates out there about whether this is right or wrong or not, but I firmly believe that, yes, there are things we need to get better at university level and at employer level around the levy, etc., and that's all part of what we need to get right in policy terms. But fundamentally, the opportunity for somebody to go through an apprentice route, I recognise as being a real opportunity for them to get into our profession. Now, despite some rhetoric out there that gets very confused, a registered nursing degree apprentice is a registered nurse. They come out with the same degree, they just get there in a slightly different way to somebody who went through a university. So I think some of the rhetoric out there that it's kind of dumbing down, it's going back to the old diploma days, is just fundamentally wrong, and I'm really firm on that. But in addition to that, we've got other opportunities for people to come through the support worker route to be able to grow, develop, and then think about step up and step off. So I know, as an example, with a nursing associate, we've got over half of our nursing associates going through a top-up programme, actually doing the 18-month or 2-year top-up to become registered nurses. So again, it just gives people that breadth of opportunity to go into it. And of course, we will still maintain a very large and significant proportion through the undergraduate route. But of course, in addition to that, postgraduate accelerated programs are really, really key. So as you can see, it's a really important opportunity to really grow, but it's actually going to require partnership across the health and education sector to get this right. And I don't just mean universities. We are going to have to think about FE colleges and others, because they are going to be important players in things like health access course programs. They're going to do foundation degrees. There's kind of step through, as an example, at Coventry University, they actually have their own FE college that's linked to health to allow people to seamlessly work through the kind of education system in a way that makes sense around employment. Now, of course, retention is really, really critical. And without doubt, through the industrial action, we've recognised, of course, that pay is an important factor. And that will never go away. And, of course, I'm not going to kind of duck the issue by saying, well, it's a decision for government. Of course, it's a decision for government around pay awards. But I think loud and clear people have heard that actually there needs to be some structural changes in relation to the way nurses are remunerated. And I don't just mean those within the NHS. I think there's a wider conversation across society about what is a graduate nurse and how should they be remunerated. But in addition to that, and this is a real challenge back to us as a profession, when I start to look at retention in more broadly, and when we did the first retention programme, it is really evident there are about 4 or 5 things that make a bigger difference, which is first is the culture that you work in. The second is the fact that actually career development CPD opportunities are really important. We are not very flexible as an employer, and I'm putting that towards the NHS, to be fair. And of course, we don't manage people's careers in the full programme of their work. So there are really important questions that we need to get right. I speak to newly qualified who tell us that actually their first year experiences are very, very poor. They often don't feel confident, their preceptorship programs are weak, they often are just left to sink or swim, which was how I trained, which is you got the blue uniform, you got your keys and you were told to get on with it. But that wasn't good then and it's not good now. So there are many aspects that sit in our gift as a profession to get right in relation to retention. So whilst we can park pay and say, yes, that's an important factor, I don't think as a profession we can sit back and wait for that to be resolved without fundamentally addressing some of the issues we have in relation to the culture of nursing. And I've said this before and I will say it again, and I think it was Professor Kitson who said this: nursing eats its young. We are not a profession that sometimes looks after its own. And that is ubiquitous across every setting we find and experience. So I think there is a real mirror, actually, to hold up to ourselves as a profession about what can we get right around retention, so when we attract people coming into our profession with a modern, contemporary, vibrant view about the skills and knowledge and experience as a graduate profession that you can, that we retain them once they arrive. You know, that is really, really important to do, because that's the most effective strategy that we can employ. But of course, there are many other subdivisions of that. So I think, as an example about equality and diversity, the experience during of retention and the experience of our black and minority colleagues throughout the NHS is exceptionally poor. You know, whether that's career progression opportunities, whether that's bullying, harassment, whether that's employment opportunities, or even disciplinary. Again, we need to take a strong and deep look at how our organisations operate, but also importantly, how do we respond as professions? And that is really important. We all have a leadership responsibility to address some of the fundamental issues that sit within the retention space. But of course, the final part, and I'll stop there because I'm sure there might be a question or two, but the issue about reform or reimagining is really important. When I see the data as an example in relation to why people choose nursing, we have got a really crowded market. We've got lots of graduate professions all vying for the people to come and work. So as an example, paramedicine is one of our strongest growth areas of allied health professions, and sometimes outstrips nursing. So there are examples out there where people can work in health, use their knowledge, skills and expertise, but actually see another opportunity that sits outside nursing. So we have to get our game together in thinking about how do we project our image of professionalism, our image of expertise as science, in terms of the graduate role we do, whether you're working mental health or physical health, or in child or in learning disabilities. How do we describe how our knowledge and expertise improves outcomes for patients? Because that's what people want. They want a career, they want to be developed, they want to see it as an opportunity for additional experience and qualifications. They want to maximise their experience and skills to deliver better outcomes for patients. These things really matter to people when they choose careers. And so when I sometimes hear the narrative from our profession, and please don't get me wrong, I realise it is exceptionally tough out there. It is sometimes hard to find the good news stories about where I see nurses and midwives making a difference. I equally find the negative ones about doing that. So we have to start thinking about how do we as a profession respond to some of these challenges and project in a way that makes sense. But of course, reimagining that is one thing in terms of how we recruit people. But then there's also about what we do in work and practice. So within the long-term plan is a very strong commitment in relation to advanced nursing practice, as an example, something that we've been on a journey for over 60 years, but actually is now starting to reformulate thinking about enhanced practice, around advanced practice. How do we bring people in so they can go on to have careers to deliver better patient care? So we've got, I think, some really important areas of development through the long-term workforce plan. We've got real reform, we've got real funding, we've got some huge amounts of work to do at every end of this process, right through to inspiring new generations, attracting them into our universities and FE colleges, absolutely giving them the high quality training through really diverse and important placements, but also about retention strategies that we as a profession must implement actively to ensure that we're able to hold on to those fine graduates that we produce into the system. And then, of course, think about long-term careers, about how do we develop people and keep them engaged meaningfully in the work they want to do, which is fundamentally always about those patients, the ones either in their clinic or at the end of the ward or in any part of the system, which is invariably why all of us probably in this room stepped into doing this role. So I hope that's been kind of helpful. It is kind of, like I say, quite a long gander around stuff, but I think there's a couple of minutes for questions. Is that right, Steve?
There is, yeah. Great.
I'll try to fill the time.
Join me, Mark.
Oh,
come on.
okay.
Go to less formal. Oh, I'll come and sit next to you, otherwise miles away. Right. Fantastic, thank you. You covered so much ground there. Very incredibly rich presentation. Thank you. And the next session is unpacking the workforce plan. I think you've already done it for us. But, perfect. So basically, yeah, I will ask a couple of questions. We haven't got that much time, but basically then it's over to you. As usual, stick your hand up and a microphone will come to you. But yeah, just to kick off, I mean, just looking, sort of stripping it right back, I suppose, to the perception of nurses. In your view, do you think the public understand what nurses do right at the sort of the start of, you know, do we need to do some work on there, like, you know, like they've done with teaching and the army and stuff, you know, things like that. It's just that does the public know what a modern nurse does?
Well, the pithy answer is no, but it's more complicated than that.
Yeah.
So as an example, there is an enduring image, both within the media and the public, that probably plays back to a very rose-tinted, old-fashioned view of what nursing is and isn't. But I think that fundamentally starts within our own profession, actually. So I think lots of us do want to challenge the kind of public perception that our job role is to just support doctors, the fact that we do very low-tech interventions, it's kind of like mopping brows, cups of tea and holding hands. All of that is important, but alongside the scientific knowledge, expertise, you know, drugs management, complexities of treatment management in mental health as an example, therapeutic relationships with those with learning disabilities and autistic people, you know, we do not project some of all of these aspects of what a modern contemporary nurse is. So I think we have to get that centred right within nursing before we can go out to the public in a way that they can engage with that as a process. Otherwise, these enduring images of old-fashioned nursing and hats and all the rest of it will still be a dominant factor in what people think is and isn't nursing. So I think it starts with us rather than the public.
Yeah, great, thank you. And the other question was, you mentioned your route into nursing and a lot of, you know, the fact that a lot of people have experience from early jobs they've done. Do we need, is there should we go back to schools, for example, and do work there to promote nursing as a you know?
Yeah, so there's a number of activities that we can do, and some of them already exist. So there's a Talk for Schools programme, which NHS England sponsor, where you can actually go out to speak to schools about that. Without doubt, we should be looking at those under 11 in terms of really generating a kind of interest about what health careers are and also what nursing looks like. But really importantly is those students who will be taking kind of choices. Now, no, not for everybody is that going to be kind of 8 GCSEs. It might be people doing BTECs or T-levels. So it's not just about going for the sort of the brightest that come out of some of our schools, actually, but purely based upon an assessment of GCSEs. Actually, for lots of students, they won't have had the life chances of lots of others. So I think we have to really look across our community to really demonstrate that we're actually supporting colleges and other ways of people to make choices about doing that, because there are so many route opportunities into nursing that fit everybody, that gets you to being a registered nursing degree, that don't require you to have 9 GCSEs at A-star, 3 A-levels and go to a red brick university. Yeah, that's great, but I'd really like to make sure that, you know, we've got equal numbers going to other universities who have done T-levels or an access course as a requirement. So hospitals, clinics, services, mental health, exactly. If you're not in schools and colleges at the moment, you should be as part of that, because you have a really important responsibility to kind of generate and drive that.
Perfect. We've had 2 questions in on Slido, which we can excitingly read there. So the first one is, salary is a key challenge as the levy only funds training. Will there be a salary support for employers to increase apprenticeships? And the second one is slightly more back to what I was asking, which is how can we enhance the public's perception of nursing and midwifery with the media constantly giving a negative image? So yeah, good questions.
Yeah, I'll be honest, I mean, the questions around apprentices I think are really important. I've been really clear that actually levy reform and approaches to apprentices both at university level, college level and employer level is, I think, are really important questions for us to pose through the long-term plan. But without that change, of course, funding is really important. So, you know, support grants around backfill, as an example, I know are really important, and my previous organisation, Health Education England, funded a lot of that. But there are important questions around how do we build sustainable models at individual things, so that there are some technical changes that you can use at the employer level that enable apprentices to be far more successful than they are. And some of that's about technical knowledge, that's about support and understanding, and also importantly funding. I think there is lots to do in that with employers to really maximise the opportunities. But in the short term, funding is going to be required. In the longer term, I think there are going to need to be some changes about how we go about that. Like I say, probably can't go into too much detail because some of this is still in flux and discussion at the moment, so I don't know quite what's going to be landed yet, but I do take that point. I think that's really important. And like I say, I've probably partly answered this one, which is, I think it starts within our profession, actually. I don't know whether colleagues have seen some of the marketing material from the US as an example. Some of it, like John Hopkins, really kind of reimagines nursing in a very, very different way. And I think one of the things is actually capturing our own professional view about what modern contemporary nursing is. And if we get that right, I think it's then slightly easier then to go out to the public with a view about what that looks like. Now, whether that's through, programs, that depict modern contemporary nursing, whether that's more nurse leaders or nurses being on TV, on news programs, talking about public health as an example. I still see examples now where a medical doctor will come out and talk about a nursing issue because they'll default to a doctor. So we've got to change that. Outside kind of health-based media as an example. So I think lots of this does sit within our gift to control, does sit within our capability, but I think some of it probably requires us to have a deeper professional conversation about what modern contemporary nursing is. But at the moment it still feels like it's in flux. There's a bit of, well, we should go back to the old days versus actually no, to inspire the future generations, we really need to focus on the kind of the competence, the capability, the expertise, what we bring to patients and outcomes.
Great, thank you. I think we're going to have to leave it there because I think the clock is against us. So thanks for listening, everyone. Professor Mark Radford, everyone. Thank you.